COVID-19 cases and hospitalizations have been increasing in Rhode Island over the past few days.
New data shows 102 people are hospitalized, up from a recent low of 92 last week. Community transmission is also slightly up since last week.
A new treatment for COVID-19 could soon be on the market in the form of an oral pill, which doctors are calling a game changer.
12 News reporter Alexandra Leslie spoke with the Department of Health about this and who we're seeing is getting infected with COVID-19. Alex?
Well, Mike and Shannon, the COVID-19 picture right now, health officials say it's still not exactly clear what's causing this recent uptick in the last couple of days. But they say the big picture right now is that with cases and hospitalizations and deaths, they are trending down overall, and more than 91% of adults have gotten at least one dose of a COVID vaccine. Recent data from the Department of Health shows a slight uptick in cases and hospitalizations.
In terms of who we're seeing in the hospital, it tends to be older, sicker people still, people who are at risk.
At-risk people includes those who are not yet vaccinated, or about 10% of Rhode Island adults. Today, Pfizer announced a new treatment that may help to bridge the gap in the pandemic.
It's meant for people who are not quite sick enough yet to be in the hospital, taken in the early days of treatment as a pill. At home.
Preliminary results show Pfizer's oral antiviral pill reduced the rate of hospitalization and death by 89% in unvaccinated adults.
So this is very exciting. It is really a game changer when you think about how we are going to be treating COVID.
There are other treatments for COVID-19, like monoclonal antibodies. Those are administered by IV for people who are already hospitalized. State health data shows about 5,500 Rhode Islanders have received that treatment since January, with 151 treatments administered in the last week.
What's so big about this Pfizer medication is that it's meant for people that aren't quite sick yet. And in my estimation, it's probably going to replace monoclonal antibodies in the future when it comes out, because it's much easier to administer. It's really going to be the go-to treatment.
Now, aside from that slight uptick in COVID-19 cases, Dr. Chan says unlike last year when there were multiple mitigation efforts against COVID and the flu, Rhode Island is starting to see some outbreaks of the flu and reminds Rhode Islanders to get a flu shot if you haven't already. Reporting live in Providence, Alexandra Leslie, 12 News.